another Medical Minute. My name is Dr. Abiola Ajayi. I'm the MD CEO of ROA Specialist Hospital here in Lagos, Nigeria. Our topic for today is the importance of health checkups. If you're following along, you can check us on social medias at ROA Specialist Hospital at Facebook, Instagram, and Twitter. You can also see us on our website, www.theroahospital.com. Our topic for today is the importance of health checkups, and I'll be breaking it down for children, adults, and seniors, and just give you a few things to think about. So let's break it down. When I'm talking about children, I'm talking about those from the ages of 0 to 12, or newborns to 12-year-olds. The most important thing to check during this age group, of course, are vaccinations, right? Are they keeping up with it? Are there any common illnesses that struggling with, asthma, any digestive problems, things like that we can also check for. And then also very important are developmental milestones, where we're tracking whether your child is growing at the appropriate size, weight, and height for their age. And at times, if you catch somebody who's developmentally delayed early enough, you can do some things to help them catch up. So those are the main things, apart from what we call acute illnesses, when the child gets sick with malaria, typhoid, or cough. Of course, bring them to the hospital then. But the importance of well checkups, bringing your child when there's nothing wrong. Every year, I like to do that before school, so a preschool kind of checkup and make sure they're growing at the right rate. There's no developmental or even behavioral or emotional issues that we need to talk about. And then we see them again a year after. For teens and young adults, we're talking about 13 to age 25, health checkups are even more important. This is the age where we start talking about puberty, we start talking about menses for women and for girls. We're focusing on sexual health, mental health, as well as lifestyle habits that these young adults may have. And it's only through regular checkups that we can pick up things like anemia, sexually transmitted diseases for some of the older ones in this group, still developmental issues in school, whether you're having trouble in school. It may be a visual impairment, you just may need glasses, maybe concentration issues. We have ways of improving that. If your child is not doing well in school or has attention span or any of those kind of issues, we can address that. And it's not always medication. Sometimes it's talking, counseling, or some things like biofeedback. So bring them in at least once a year for that yearly checkup. So let's talk about adults. I like to consider myself one. When we're talking about, these are age 40 to 60. Of course, 25 to 60, we're also calling adults, but it's even more important when we're looking at age 40 to 60. Above the age of 40, we should be doing comprehensive checkups yearly, and that's for men and women. For men, we're looking at things like prostate health, erectile health, sexual health, high blood pressure, and diabetes. We're doing the same for women, but instead of checking for the prostate, we're checking for things like cervical cancer, breast lumps, and so on. It's important to remember that during this age group, 25 to 60, yearly checkups are important. And 40 to 60, they're even more important, because these are when a lot of diseases want to start, like high blood pressure, diabetes, rheumatic diseases, arthritis. You see them in this age group. It's important to know that the sooner you catch one of these diseases, the better for you, because it can be treated, possibly cured. There's a statistic that says $1 spent on prevention will save you $10 on the cure. It's the same thing for Naira. So, and at times, for example, like diabetes or high blood pressure, at times if you catch it early enough, we may be able to do lifestyle changes, diet and exercise, or supplements that can help without going on lifetime chronic medications. For seniors age 60 and above, the same continues, but what we also do here, yearly comprehensive exams. We're looking at the leading causes of death, which usually revolve around cancers. For men, it's prostate cancer. For women, breast cancer, cervical cancer, and ovarian cancer. We have rectal cancer in both parties, men and women. So we do screening tests for these. We try and assess your risk for them. And what if the thing is positive, if there's a disease that we find, do not lose hope. Like I said before, the earlier we catch it, the better for everyone. The cheaper it is, and the longer your life will be. So it's important to recognize as elderly, 16 above, that yearly checkup is still very, very important. So no matter what your age, health checkups are vital. Yearly or even more frequently, depending on the diseases you have. I always like to encourage people. So if you hearing this on social media, when you come to the hospital, you can reach us on ROA Specialist Hospital on our social medias. You can call our front desk at 080-888-62-635, or you can check us on our website, www.theroahospital.com. If you mention that you saw us on social media, we have a giveaway for you. Thanks. Die for all.